As a pediatric oncologist, one of the questions I do face from parents is, will my child lose hair during chemotherapy? The answer is yes and no. Again, it's a little more complicated than a straight yes, because all chemotherapy is not the same. I have a favorite statement or quote of my own that there is no umbrella chemotherapy. So chemotherapy is a very broad term that can be used for medications ranging sometimes even from an antibiotic to something that may affect, the heart, the kidneys, the liver, etc. So yes, chemotherapy will cause your child to lose hair depending on what is the medicine that is used, what is the dosage that is used, and how long or how many cycles the child is going through that particular chemotherapy agent. Most often, acute leukemia chemotherapy, brain tumor chemotherapy, all these are the ones which would cause your child to lose hair. There are some tumors like Wilms tumor. There are very not very aggressive cancers like APML, where we don't really use very aggressive chemotherapy or at very high doses. And these patients would, of course, not face the challenge of losing their hair. So as I said, the answer is yes and no. Depending on the medicine that's being used, how many cycles and how many doses, your child might or might not lose hair due to chemotherapy. But never be under the misconception that because the child is not losing hair, the chemotherapy is not working. That is common misconception, and we actually have parents who come up and ask, you said you're giving chemo, but the child is not losing hair. So chemotherapy, as I said, is an umbrella term. It's a very big term that applies to a broad number of drugs that might come with different side effects. So make sure to discuss this with your pediatric oncologist in detail.